Hi, everyone, and welcome. Thank you so much for joining us. This is the Children's Mental Health Matters campaign. My name is Jess Fort. Today, we have Marlo Lemon from Parents Place of Maryland. This session is going to be about equipping yourself with the knowledge and tools necessary to foster stronger family-school partnerships that enhance the educational experience for all families. Our presentation is going to cover the introduction to Parents Place of Maryland, their commitment to empowering families as advocates and partners in education and healthcare. We're going to define family engagement and parent advocacy, gain a clear understanding of what family engagement and parent advocacy entail, and why they are crucial for student success. Barriers to family engagement and school partnerships, identifying common challenges that make family engagement difficult, and explore strategies to overcome these obstacles. Exploring additional ways to support families, discovering innovative methods and resources to further assist families in becoming active, informed, and collaborative participants in their children's education. This is extremely timely as we enter the school year, and a great opportunity to learn a little bit more about how you can become a partner with your child's school. A little bit about our presenter. Marlo Lemon is the Co-Deputy Director of Training and Strategic Partnerships at the Parents Place of Maryland. She is most proud of her role as a wife and mother of 3 children, 2 of which have IEPs. Prior to Parents Place of Maryland, Marlo has provided professional development to parents and staff in Baltimore and Howard counties. She has taught in Baltimore City and Baltimore County school systems. In her position as educational specialist for the Maryland State Department of Education, she worked in Title I schools, early childhood, and special education. Currently, she teaches the Working with Families of Students with Disabilities course at Towson University. Marlo values relationships and believes all children can succeed, and parents and families are the best resource for each other. Thank you so much and welcome, Marlo.
Thank you so much, Jess. I really appreciate the introduction and the ask from the Mental Health Association of Maryland. It is such a great partnership because we work with very similar parents and families, and the families that you send our way, we really appreciate it. So thank you very much for the partnership. And I am excited to be here this afternoon just to share some information about the Parents Place of Maryland and information on enhancing family engagement and parent advocacy. As Jess has shared with you, I am Marlo Lemon, Co-Deputy Director of Training and Strategic Partnerships here at the Parents Place of Maryland, and I am happy to be here. Today, my goal is to share information about the Parents Place of Maryland, define family engagement and parent advocacy. We're going to discuss some barriers to family engagement, and then discover and talk about ways that we can support parents and families. Our mission at the Parents Place of Maryland, we are not advocates. Our mission is to empower families as advocates to improve the education and health outcomes for children with disabilities and special health care needs. We always say we're not advocates because the parents and families are the longest standing people at that IEP team, and you know your child best. So our job is to really equip you to go into those meetings feeling empowered. We have been around for over 30 years. We were established in 1990. Our board are all parents who have children with disabilities and special health care needs. And our whole team, as you can see 2 pictured, that's Kim and LaShonda, our whole team either has children with disabilities and special health care needs. So when parents and families call, we are able to share information with them from a lens of we understand where you're coming from. Our website is ppmd.org. That's ppmd.org. But we are a part of a larger system. PPMD is Maryland's Parent Training and Information Information Center. So we are an independent nonprofit that provides evidence-based research information to families to make the best decisions for their children and young people with disabilities and special healthcare needs. If you are on this call and you have family members that live in another state and say, oh, your resources would be very helpful, or you not have family members, but you don't live in the state of Maryland yourself, you can go to Parent Center Hub. That website is at the bottom of this slide, and find your parent training and information center in your state. So we are there. Parent training information centers are in every state, and you can find one, your local one where you are, that will be able to provide information to parents and families of children with disabilities and special healthcare needs. What do we do at PPMD? We help families understand their child's diagnosis. We work with parents and families birth to age 26. We help parents and families communicate effectively with schools and community organizations, understand their rights and responsibilities under the special education law, obtain services. On our website, we have wonderful model letters if parents are not sure how to address or ask different questions, and we connect to community resources. We provide one-on-one assistance through our parent educators. So if you were to call our office or send in an email through our Contact Us page, you would get a parent educator that will call you back and provide any assistance that you might need. Let's say you have a question about your IEP, you can send them in a copy of the IEP, and they'll be able to walk you through questions to, again, help empower you as you are sitting at the IEP team. We try to share as many resources as possible. We have wonderful partnerships like the one we're on today. We have topical trainings. So we've had trainings on behaviors, how to read and understand progress reports, siblings, and things similar to SIP shops. So we've had a lot of different topical trainings based on the needs of so many of our parents and families. We also have leadership trainings. And in our leadership trainings, we are giving parents and families the tools to help them work more effectively with the school system and school system staff. We also have a parent educator who specifically works with our military families. Maryland is the 8th largest state as it relates to military bases. And as a result, we have a lot of parents and families who might be deployed, either both parents or one parent, and the other parent is here trying to provide, or grandparent trying to provide services for their child or young person with a disability and special healthcare need. Know that we are here and we have a person with that military knowledge and background to help parents and families navigate that journey. This is my why. Again, I said every staff member at PPMD has a family member that's close to them with a disability or special healthcare needs. I am blessed to have 3 children. I'm the mom of my double blessing and little surprise. And we started in the infants and toddler system when my young men were 19 months old. So as a result, I have been through the special education programs within public school system. So these are my 3 young men with my daughter who came 18 months later. So I was one that had 3 under 3. So when you ask me why I do this work, it is for my children. Our website, again, is ppmd.org. And when you go to our website, you will see this page, and if you click on Contact an Expert, you will see this page. We have information in English and in Spanish. We also have a bilingual parent educator who can help and assist our Spanish-speaking families. So when you touch Contact Us, this form will come up. Fill in the information, and a parent educator will be able to call you back within 24 to 48 hours. Since this is the month of September, we are very, very busy. We are a small but mighty group. So please know that we'll call you back within 24 to 48 hours and try to address your concerns, but take the time to really look at our website and some of our resources that are there. Family engagement, and why is it important, and why, we are not advocates, but our role is to empower you. When we think about the definition of family engagement, it's family and schools working together, families getting involved and speaking up and feeling comfortable speaking up, meaningful involvement, commitment. How will schools know that what families want if we don't feel comfortable telling them? So active support and commitment from families is so important. And that's what family engagement is. And the benefits are so rich, because the benefits of family engagement is improved student achievement. Research has shown that with family engagement, we have better behaviors, enhanced social and academic skills within our students and families. And it benefits students to see their parents and families involved. Family advocacy, that's the action that's taken. So we have engagement. We're attending our PTA meetings. We're attending events that are happening at the school. And when we think about the advocacy piece of that, that's understanding the educational policies and being comfortable and feeling comfortable speaking up to advocate for your child's or your young person's educational rights. And sometimes knowing the laws and being able to say, show me where that is written, or where is that policy written? Explain to me why. How can I help? How can we know that this is the right path to take? So being comfortable asking those questions, because again, it's all about improved student achievement and student success. The benefits of advocacy is students receive the appropriate supports that they need, and it's tailored to meet their needs. So when we think about advocacy, we know that every student is different. So what does your student or your family need that they can advocate for that will help improve their academic performance? You, as parents and families on the call, know your children best. As providers on the call, it's our responsibility to get to know the families that we're working with, to get their needs so that we can help them and support them the best way that we can. Why family engagement matters. These are the 3 top things why family engagement and parent advocacy matters. Research links active family engagement to better academic performance and emotional well-being. Collaborative families contribute to the school environment and a positive school climate. And advocates for equal opportunities and resources ensure that all students have access to quality education. We do know, however, that there are some barriers to family engagement. And when we think about barriers, what is causing parents and families not to be able to come into the schoolhouse, not to feel comfortable? There are a lot of different things. So sometimes it's lack of information. Is the information you're providing to parents and families coming to them in their native language? Knowing the age of some of our students, are parents and families getting the information? Are we just sending home flyers, or are we using some technology, some apps? how are we communicating with our parents and families is a question we can ask, because sometimes that is a barrier. Relationships. What are we doing as providers to get to know our parents and families? Get to know when are they available, some of the things that they might need. Thinking about, did parents and families not have a good school experience themselves? Sometimes coming in, we used to always say as providers that sometimes the school administrative assistant are one of the most powerful people, because when you walk in, they're typically the first ones that parents and families might see. A lot of times it's the availability of childcare. They might want to come to a program or something at school, but if childcare is not available, they might not have then the funds or the time to be able to attend. Health. We know that parents and families all have different experiences, all have different physical and mental health needs that might be a barrier for them being able to actively participate. Finances, transportation, time. What time are we setting programs, setting workshops, inviting parents to come in? We might have to think about different ways and different times so that we can be open to having different types of programs, and that might look different. Some they might be virtual, they might be hybrid. You might now have a hybrid option if you're doing a parent, or if you're a provider and you have a workshop schedule. Is there an opportunity for it to be hybrid, so some parents can come, families can come in, and some can then have it either on their computer or on their telephone? And hopefully we will be able to have any others that you might be thinking about. These are some strategies for overcoming some of those barriers. We talked about time constraints. So offering flexible times. We have at Parents Place of Maryland, we have different leadership trainings. For our Spanish speaking families, we have that trainings, I think Thursdays around 5 or 5:30, because that's what the families have said, that that's a time that works well for them, because we have so many families who might work swing shift, who might work nights, or who might have two jobs. So then we have modified some of our training time and schedules to be beneficial to our parents and families. We know that sometimes language barriers can be really, really vast. Are we offering the information, the flyer in another language? In the Eastern Shore area of Maryland, we have a large Haitian Creole population. Are we sending in information in English and Haitian Creole? Do we have an interpreter or translation services that might be available? Are we being culturally responsive to our audience if we have providers that are on the call? And for parents that are on the call, how can we help relieve some of the barriers? So I want you to think about those questions. Sometimes there's a lack of resources. When we think about the state of Maryland, and Parents Place of Maryland works in all 24 county school districts within the state of Maryland, but we know we have rural areas, and we know sometimes that the internet and technology might be harder to access than living in the city. And then we have to, as providers, work on building trust and being transparent with our parents and families. Building trust, getting to know the parents and families sometimes will alleviate that parent who may have had a bad school experience themselves. And if they had a bad school experience, they might not then want to come into the schoolhouse or want to go to that meeting. So then how can we get that family experiences and information, because they may have had negative experiences themselves? So these are all some strategies to overcome barriers. These are some other ways, or some additional ways we can support families. Think about this collaboration that we have, and how can Parents Place of Maryland advertise information for the Mental Health Association? And I think that we've been able to partner great in a lot of these lunch and learn meetings, seeing each other at resource fairs. What other community partnerships can we collaborate with that we're out there getting information to parents and families? What other partners, whether it's MCF, if you have a parent or family that you're working with, what other agencies are they working with that we can possibly partner with to best support the family? Offering family workshops like this. A little bit later, I'll share with you about Parents Place of Maryland's Coffee and Conversations. Having digital platforms. I know the schools do a great job with Class Dojo and Schoology and some other apps that they're now using. With our bilingual educators have shared with us that some of their Spanish families like the WhatsApp for communication. So really thinking about platforms, digital platforms we're using. Family resource centers, how can they support? Well, we have one place where all of our information can be there because parents and families are receiving so much information from so many different resources. And then asking the family for their feedback. What do you need? How can we be supportive? What areas do you see as a barrier? And how can we then support you and your family in those needs? We know that home and school partnerships make such a difference when we have effective family engagement. It has a positive impact on learning. And when we have strong partnerships, it empowers parents and families. It is so nice to be able to connect and engage. And we know when we connect and engage, we are able to sustain our parents and families. And when we are earlier we were talking about self-care. When we're sustaining our parents and families, it only makes for successful students and successful homes and families. We have so many of these different resources on our website. It's no more than a 10-minute video on a YouTube video on self-care, because we know for providers and for parents that we have to put our mask on first in order to help our children or our young people as parents, and as providers in order to help our families. So please take care of yourself first. But that's we have not only printed resources, but we also have resources on YouTube and Instagram to help parents and families. And we're trying to increase our virtual connections to be able to help as many families as possible. When you go on our website, if you click in resources and just the search bar, and so many different resources will come up. We have a lot of fact sheets. This is just a small sampling of the fact sheets that we have. And actually, I challenge you to go on ppmd.org, and if you put in family engagement, it's a fact sheet that'll pop up and it'll talk about the benefits of family engagement. This is one that we have on extended early intervention services. We try to keep our fact sheets at a elementary reading level for all of our parents and families, recognizing that everyone that we don't have, some families are not readers. We also have information in English and Spanish. We have monthly coffee and conversations because we want our parents and families to connect. You can get on from any county in the state. This is to share ideas. They are virtual, to meet other parents, because sometimes along this journey, you might feel alone. You might think that you're alone, or you might be thinking that you're the only family that has a child with special needs. So these coffee and conversation groups allow our parents and families to get together, to share frustrations and resources with others. These are the categories that we have them in: birth to kindergarten, elementary and middle and high school, and Spanish speaking. And our Spanish speaking coffee and conversation is one of our largest groups. And that group meets the first Wednesday of every month, but it's actually on our site as well. We have monthly newsletters in English and in Spanish. This says bi-monthly, but we now have a monthly newsletter in Spanish as well. We don't flood your emails, but we will give you a monthly newsletter, which has all the latest and greatest information that you might need. Again, I share that we have Facebook as well as Instagram and YouTube. Our YouTube videos, some in English and Spanish, are categorized, and you could do it like early childhood. So no matter what age the child or the family that you're working with, just look at our playlist and hopefully you'll be able to find a resource to help your parents. I am a quotes person, and this one is one that speaks to me all the time, so I will read it. Every child deserves a champion, an adult who will never give up on them, who understands the power of connection and insists they become the best they can possibly be. And that's by Peter Peterson. Let me know what you thought about today's presentation, what I might need to add, take away, and any information you might need. I would love to be able to brainstorm ideas and innovative ideas on increasing family engagement. This is my contact information, marlo@ppmd.org. Thank you so much for listening and for joining in today. I really, really appreciate it.
Wonderful. Marlo, thank you so much for joining us today and giving us all that good information about reducing barriers and really strengthening the relationships and partnership. I'll ask real quick, not to call you out. Alyssa, might you have a question for Marlo before we close out today? Okay. All righty. So thank you again, Marlo. You all will receive a follow-up email with a link to the recording of this presentation, as well as a survey asking for your feedback on how we can continually improve these webinars for you. We invite you to join us for next month's webinar, Hope and Positive Childhood Experiences, with Amy Myrick from the Change the Conversation organization. We continue to look forward to working with all of you to support the well-being of families and communities across Maryland. If you have any questions, please reach out to us at info@cmhm.mhamd.org. Thank you again.
Thank you so much, and thank you for having me.